Welcome and thank you for standing by. All participants are in a listen-only mode until the question and answer session of today's conference. At that time, you may press star 1 on your phone to ask a question. I would now like to turn the conference over to Laura Morrell. You may begin.
Thank you, Shauna. Good afternoon, everyone. My name is Laura Morrell, and I work in the One Health Office of the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of the One Health Office, I'm pleased to welcome you to the monthly Zoonoses and One Health Updates call on October 2nd, 2019. ZOHU call content is directed to epidemiologists, laboratorians, scientists, physicians, nurses, veterinarians, animal health officials, and other public health professionals at the federal, state, and local levels. Please be aware that CDC has no control over who participates on this conference call. Therefore, please exercise discretion on sensitive content and material, as confidentiality during these calls cannot be guaranteed. Today's call is being recorded, so if you have any objections, you may disconnect. Detailed instructions for obtaining free continuing education are available on our website and will be given at the end of this call. These presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. The Planning Committee reviewed content to ensure there is no bias. CDC did not accept commercial support for this activity. CDC, our planners, presenters, and their spouses or partners disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. Before we begin today's presentations, Dr. Casey Barton-Baravesh, Director of CDC's One Health Office, will share some news and updates. Dr. Barton-Baravesh.
Thanks, Laura. Hello, everyone, and thanks for joining us for today's ZOHU call, and welcome to all of our new call participants. The ZOHU call audience continues to grow, with subscribers representing professionals from government, non-governmental organizations, industry, and academia, including students. We appreciate your help spreading the word about the ZOHU call. Please continue to share the ZOHU call website link with your colleagues from human, animal, environment, and other relevant sectors. The site includes links to past call recordings, information on free continuing education for a variety of professionals, and a link to subscribe to the ZOHU call email list. To begin today's call, I'd like to share a few highlights from the One Health news from CDC, which are included in today's ZOHU call newsletter. First, CDC's released the annual report on surveillance for foodborne disease outbreaks in the United States for 2017. Some upcoming observances include the Infectious Diseases, or ID Week annual meeting, which started today in D.C., and the Rabies in the Americas Conference, which will take place in October 27th through November 1st in Kansas City. Also, One Health Day is coming up on November 3rd, so please join CDC and partners around the world in celebrating One Health Day. There are 3 new One Health-related expert commentaries from CDC that are now available on Medscape's website. We've shared links to recent publications on several topics, including salmonella infections linked to whole roasted pigs, and a multi-state outbreak of E. coli infections linked to soy nut butter. Highlighted MMWR topics include surveillance for coccidiomycosis in the United States, zoonotic Mycobacterium bovis disease in deer hunters in Michigan, and hantavirus pulmonary syndrome in Colorado. Regarding outbreaks, the outbreak of multi-drug-resistant salmonella infections linked to contact with pig or dog treats has been updated. We'll learn more about this outbreak during today's 3rd presentation. Final updates to the outbreak of salmonella infections linked to papayas and the outbreak of E. coli linked to ground bison have been posted. And the selected list of ongoing and past U.S. outbreaks of zoonotic diseases, as well as information on staying safe and healthy around animals, is available on CDC's Healthy Pets, Healthy People website. As always, the complete CDC current outbreak list, including foodborne outbreaks, is available at cdc.gov/outbreaks. As always, if you would like for us to share news from your organization, or if you want to suggest presentation topics or volunteer to present, please reach out to us at zohucall@cdc.gov. Again, thank you for supporting the ZOHU call and for joining us today. I'll now turn the call back over to Laura.
Thank you. Today's presentations will address one or more of the following objectives. Describe 2 key points from each presentation. Describe how a multisectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources from CDC partners. Questions for all presenters will be taken at the end of the call. Call 1-800-593-8936 and enter participant passcode 9611836. Press star 1 and give the operator your name and affiliation. Please name the presenter or topic at the beginning of each question. You'll find resources and links for all presentations on our website and in today's ZOHU call email. Our first presentation, Evaluation of Waste Anesthetic Gas Exposure at a Veterinary Hospital, will be given by Jessica F. Lee and Dr. Sophia Chu. Please begin when you're ready.
Good afternoon, everyone. My name is Jessica Lee, and my co-presenter is Dr. Sophia Chu. We work for the Health Hazard Evaluation, or HHE program, within the National Institute for Occupational Safety and Health, or NIOSH. For those who aren't familiar, NIOSH is an institute within the CDC that focuses on conducting research in occupational health and safety. NIOSH's mission is to develop new knowledge in the field of occupational safety and health and to transfer that knowledge into practice. The HHE program is a program within NIOSH that conducts workplace epidemiologic and industrial hygiene investigations at the request of employees, employers, or unions. Our objective is to determine if there are harmful workplace exposures or conditions that could be causing injuries or illnesses. One of the hallmarks of our program is that we involve all parties at every step, and our service is provided at no cost. Next, we'll dive into the HHE request. In March of 2017, the Health Hazard Evaluation Program received a request from 3 anonymous employees at a veterinary hospital. They were concerned about waste anesthetic gas, or I'm going to refer to it as WAG from now on, exposure and reproductive health effects, including miscarriage and infertility. So WAG is defined as anesthetic gas that leaks into the air during delivery of anesthesia. At this hospital, isoflurane was the primary inhalational anesthetic used for most procedures, including surgeries. In February of 2017, a veterinary technician in the surgery department discovered that both active scavenging systems, which are engineering controls for WAG, in the 2 operating rooms were incorrectly connected. The employees were concerned about potential WAG exposures during this incorrect connection. The veterinary hospital did correct these connections immediately upon discovery. So isoflurane is a general inhalational anesthetic approved by the FDA in 1979. An occupational exposure limit, or OEL, is a maximum concentration limit that a worker can be exposed to for a particular substance. OELs are set by various governmental agencies and related organizations, ideally using health data to prevent occupational illness and injury. The Occupational Safety and Health Administration, or OSHA, has not set an OEL specific to isoflurane. NIOSH has not set an OEL specific to isoflurane, but instead uses an OEL that is designated for exposure to WAG of 2 parts per million for a 60-minute time period. It is important to note that this OEL was determined using health data on halogenated anesthetic agents that are considered more harmful than isoflurane is. Other countries and agencies have set isoflurane-specific OELs. And just to briefly go over, the main controls for WAG are scavenging systems, which include active and passive scavenging systems. Active scavenging systems using a source of negative pressure are the preferred method when possible. For this evaluation, we spent 2 days in the veterinary hospital. Our objectives were to determine if the scavenging systems and building ventilation system were effectively removing WAG, to assess employee exposure to isoflurane, and to determine the prevalence of employee symptoms and learn more about reproductive health concerns and outcomes among employees. In the interest of time, we will be focusing on the last 2 objectives for this presentation. In order to meet our objectives, we evaluated employee isoflurane exposure before, during, and after surgery, and measured area concentrations of isoflurane throughout the vet hospital using the following industrial hygiene sampling methods and equipment. We also interviewed employees about their work and health, focusing on reproductive health. We ended up collecting personal air samples for isoflurane on veterinary technicians, veterinary surgeons, and a veterinary surgeon intern. In total, we collected 10 full shift samples, most of which were under the limit of detection. One veterinary technician did have a full shift exposure that was measurable at 0.076 ppm. We also ended up collecting 36 60-minute samples for isoflurane. These are the results of our 60-minute samples. All but one were under the NIOSH OEL of 2 ppm. The overexposure was collected on a veterinary technician while they recovered a dog after surgery. We observed that factors such as body position, length of recovery, and animal size could have affected the amount of exposure that that employee had. We also collected full shift area air samples for isoflurane in the following areas, and all samples came back under the limit of detection. And with that, I will turn it over to Dr. Sophia Chu to discuss the medical results.
Thank you, Jessica. So let's switch gears and talk about the interviews. There were 36 employees working during the site visit, and all of them participated in the interviews. Median age at the time of the site visit was 32.5 years, and the median job tenure was almost 2 years at 23 months. 78% of all interviewed employees were women of childbearing age, defined as 15 to 44 years old. 22% of employees had concerns about reproductive health related to work. All of these employees with concerns were women of reproductive age. 9 employees reported 21 pregnancies while working at this veterinary hospital, represented as circles on this slide. Of these, 7 employees reported 12 miscarriages while working at this veterinary hospital. All 12 occurred during the first trimester and were considered early miscarriages, i.e. during the first 13 weeks. 2 employees had 3 miscarriages each, 1 employee had 2 miscarriages, and 4 employees had 1 miscarriage each. 6 of the 7 employees reported ever working in the operating room. 5 employees were aged 40 or more years at the time of the miscarriage, and that was the most common age category. In summary, we did not have enough information to conclude that there was a substantially higher rate of miscarriages at this veterinary hospital after taking into account maternal age, reproductive history, and other non-occupational risk factors. Miscarriages in general are common, with 10 to 25% of all clinically recognized pregnancies ending in miscarriage. In conclusion, we found 1 isoflurane overexposure in a veterinary technician recovering an animal. We also found 12 miscarriages among 21 known pregnancies, but that might not be excessive after taking into account maternal age, reproductive history, and other risk factors. Miscarriages while employed at this veterinary hospital could not be linked to waste anesthetic gas exposures. We made recommendations to reduce employee exposures to waste anesthetic gases. Recommended steps included replacing passive scavenging systems with active scavenging systems, consulting with a ventilation engineer to ensure that the hospital's ventilation system prevents exposure to waste anesthetic gases, properly maintaining existing anesthesia machines and scavenging systems to minimize leaks, avoiding being near an animal's head before and during surgery and when recovering an animal after surgery, and educating employees at least annually on procedures for reducing exposures to waste anesthetic gases. Thank you to everyone who helped us with this evaluation and presentation. Please let us know if you have any questions, and you can find our report at the link on the screen. Thank you.
Thank you. Our next presentation, Antimicrobial Use and Stewardship on Cattle Feedlots and Swine Operations, an update on the NAHMS 2017 surveys, is by Dr. Chelsea Shively. Please begin when you're ready.
Thank you. Good afternoon, everyone. My name is Chelsea Shively, and I am a veterinary epidemiologist working on antimicrobial use and resistance with the National Animal Health Monitoring System, or NAHMS, within USDA APHIS Veterinary Services. Today, I'm going to share some of the results from the 2017 NAHMS antimicrobial use and stewardship studies that we conducted in swine and feedlot cattle. As stated by my PhD advisor, Dr. Temple Grandin, you manage what you measure, which is where NAHMS come in. So why should we measure antimicrobial use? So there's a few different reasons. And first of all, for animal health reasons. Antimicrobials are powerful tools that can be used to combat infectious diseases in our animal populations, which can be important for improving animal health and welfare. Secondly, antimicrobial resistance concerns. If animal pathogens develop resistance, the antimicrobials will stop working and animals will no longer respond to treatment, which can negatively impact their health and welfare. And finally, we are concerned about public health. So antimicrobial resistance pathogens in livestock may be able to pass their resistance onto human pathogens. This could result in antimicrobial drugs not being effective for treating human infections as well. NAHMS is here to help tell the story about antimicrobial use in livestock, as well as reporting on trends in use over time. In 2015, the U.S. government published the first National Action Plan for Combating Antibiotic-Resistant Bacteria, providing a roadmap for federal agencies to summarize their activities on this issue. The USDA then developed the USDA Antimicrobial Resistance Action Plan. USDA possesses in-depth knowledge of the management practices and technologies associated with animal health, welfare, productivity, and food safety. As such, USDA is uniquely positioned to contribute to the body of scientific knowledge about antimicrobial resistance and specifically about the role of antimicrobial use in livestock. Currently, the U.S. government is developing the next National Action Plan for years 2020 through 2025, and USDA has been actively involved in this development. The USDA initiated the National Animal Health Monitoring System, or NAHMS, in 1983 to collect, analyze, and disseminate data on animal health, management, and productivity across the United States. NAHMS conducts national studies that are designed to meet the information needs of the industries associated with these commodities, as identified by people within those industries and other stakeholders. So why NAHMS for antimicrobial use information? NAHMS has over 30 years of sharing information from animal agriculture through our national studies, including historic information about antimicrobial use and resistance. NAHMS has decades of being a trusted partner with the livestock commodity groups. Continued responsible use of antimicrobials will help preserve their effectiveness well into the future for both human and animal use. The hallmarks of a NAHMS study are that our studies are national in scope. The unique design of NAHMS studies allows us to provide national estimates. Our studies are collaborative. We work with industry representatives, producers, veterinarians, and other stakeholders to develop our studies. We also work with the USDA National Agricultural Statistics Service, or NASS, for most of our studies. NOM studies are voluntary. We do not have regulatory authority, therefore producer participation is entirely voluntary. Our studies protect producers' privacy, and this is very important to ensure that producers continue to participate in our studies. Our studies are all scientifically based and statistically valid. This is a core value of NOMs. We have other recent and future NOM studies that have collected information on antimicrobial use, and in some cases, we have collected biological samples to test for bacterial prevalence and antimicrobial susceptibility. These include the Dairy 2014 study, where we have information on antimicrobial use in all ages of cattle, as well as biological samples testing for antimicrobial resistance, the Equine 2015 study, and the Cow-Calf 2017 study. We are currently conducting our Goats 2019 study, and we'll be collecting information on antimicrobial use. In 2017, NOMS conducted the first focused studies on antimicrobial use in food-producing animals, including swine and cattle on feed, with a focus on antimicrobial use in food and water. The NOMS approach is to develop national estimates of overall antimicrobial use and not to provide detailed antimicrobial use metrics or quantified numbers. The study objectives include describing antimicrobial use practices in feed and water, estimating the percentage of operations administering and the percentage of animals receiving specific antimicrobials by reason for use, providing baseline data on antimicrobial use practices in 2016 in order to evaluate trends over time, and describing antimicrobial use practices on these production sites. We collected antimicrobial use and stewardship practices in 2016 in order to capture information about practices before the FDA Guidance for Industry number 209 and 213 were fully implemented in January of 2017. And these studies were designed to be repeated over time to evaluate trends. These studies were conducted under CDC, or the Confidential Information Protection and Statistical Efficiency Act. CDC studies provide the strongest protection for data collected by the federal government for statistical purposes, and it protects the data from FOIA requests. However, CDC requires additional burden on the people involved with collecting the information, and it makes the information collection a one-way street, so we cannot provide individual results back to producers. For the Swine 2017 study, the states that were sampled represented 92% of market pigs and 94% of sites with 1,000 or more pigs, according to the 2012 Ag Census data. We had a total of 13 states that participated, and we sampled nursery, grower-finisher, and wean-to-finish operations. And for the swine study, we focused on a 6-month data collection period of July 1st through December 31st, 2016. The cattle on feed study, we had a total of 22 states that participated with 50 or more head capacity of cattle on their feedlots. And the data collection period was January 1st through December 31st, 2016. Overall, these states represented 94% of cattle on feed and 93% of feedlots, according to 2012 Ag Census data. This study was conducted similarly to most of our NOM studies. We started with our study design phase, where we received input from industry representatives and other stakeholders. We then worked with NASS to select the sample of operations to participate in each of the studies based on their list frame, and the selection was stratified by state and size of operation. NASS then had the initial consent, which was conducted between May and July of 2017. They also received consent to be able to share the contact information with veterinary services. The veterinary services questionnaire was administered from July through September of 2017, and this is where we collected the information from producers. Once we collected all of the questionnaire data, the questionnaires were mailed to Fort Collins, Colorado for data entry, followed by an in-depth data validation process, as well as data analysis. And finally, the reporting phase, Our reports were published on the NOMS website in May of 2019. Our survey responses for these studies, overall we had 196 swine sites and 378 feedlots that participated in providing complete information for this survey. I will note that the swine study was updated in August of 2019 because we found that 3 of the sites originally included did not meet the eligibility criteria. Now I would like to share some of the selected results from the swine 2017 survey. Overall, 98% of swine sites used any antimicrobials from July 1st through December 31st, 2016, which includes all types of antimicrobials, including ionophores, and multiple routes of administration, including water, feed, and injection. So orientation to this graph, the x-axis shows the route of administration, and the y-axis shows the percent of sites. Overall, antimicrobial use in swine by route of administration. Most sites were using some antimicrobials, with 98% of all sites using any antimicrobials. For more detailed information about this graph by size of sites, please see the report. This graph shows antimicrobial use in swine by age and by route of administration. Information about injectable antimicrobials was not captured by age. Regardless of age, more sites used antimicrobials in feed than water. For water use, all aged pigs, the primary reason for use was for respiratory disease and diarrhea. For in-feed use of antimicrobials, the primary reason for use in nursery-age pigs was for respiratory disease and diarrhea, and for grower-finisher-age pigs, it was for respiratory disease and growth promotion. Overall use of medically important antimicrobials in swine by size of site and by the route of administration is shown here. Overall, 76% of sites used medically important antimicrobials in water, 89% in feed, and 94% in water or feed. And these medically important antimicrobials were defined by the FDA Guidance for Industry number 152. This graph here shows the percent of sites that ever recorded information about the date antimicrobial use began, the date the antimicrobial use ended, what antimicrobials were used, and the treatment withdrawal period. Overall, most sites recorded the date antimicrobial use began and the antimicrobial that was used. Regarding veterinary use, almost all sites had a veterinary-client-patient relationship, and about 2/3 of sites were visited by a veterinarian during the 6-month period for data collection. Moving on to selected feedlot results. Overall, 88% of feedlots used any antimicrobials in 2016, which again included all types of antimicrobials, including ionophores, and multiple routes of administration, including feed, water, and injectable. Here we see the antimicrobial use in cattle by route of administration. Feed and individual injections were the routes used by the highest percentage of feedlots. A total of 88% of feedlots used any antimicrobials, and very few feedlots administered antimicrobials in water. Here we see the antimicrobial use in feed by placement weight, and this information was only captured by feed use. About 70% of feedlots used antimicrobials in feed, regardless of placement weight. Here we have antimicrobial use in feed and cattle by medical importance, as determined by the FDA. The only non-medically important antimicrobials used in feedlots were ionophores, and these were often used in combination with another medically important antimicrobial. All antimicrobials used in water or by injection are considered to be medically important. This graph here shows the information that was ever recorded. For use in feed and water, the date antimicrobial use began, date antimicrobial use ended, and antimicrobial use was recorded by about 60% of feedlots. Also, antimicrobials were rarely used in water on feedlots. Overall, 80% of feedlots used a veterinarian in 2016, and all feedlots that did not use a veterinarian said that they did not need one. 97% of feedlots were familiar with the veterinary client-patient relationship in 2016, and 85% said that they had a VCPR. We expect the percent of feedlots with a VCPR to match the percent of feedlots using antimicrobials in feed in the next survey due to changes in FDA policies. Overall, we encountered a few challenges along the way with these studies. We had lower than expected response rates, which required additional exploration of potential bias due to non-response. Ultimately, we determined that the results are nationally representative, so we would like to see better participation in future studies. We must balance between reducing the burden and collecting information. But next go around, we will be adding additional questions related to animal health for future studies in order to broaden the scope and provide additional context about antimicrobial use. Finally, we recognize that antimicrobial use is a sensitive topic for producers, and there's nothing that we can do about that. However, we would like to continue to share the positive changes that industries have made regarding antimicrobial use and stewardship. Our reports can be found on the NIOSH website. However, it's easiest just to Google NIOSH and find them under the antimicrobial use and stewardship section. And we will be repeating this data collection in 2020. For the swine part, it will be included in the larger NIOSH Swine 2020 study. And for feedlots, we will have a health management on U.S. feedlots 2020 study that will be questionnaire-based. Conducting these surveys again will allow us to report on trends in antimicrobial use over time. We are also developing Tableau dashboards to be able to better visualize the results of these studies beyond our reports that we publish. These studies would not be possible without a number of people, but I especially want to thank the producers who participated in the surveys and all of those who helped us with the development and implementation. Thank you, and I'll take any questions at the end of this presentation today, or I'm happy to answer questions via email.
Thank you. Our final presentation, Outbreak of Multi-Drug Resistant Salmonella Infections Linked to Pig-Eared Dog Treats, is by Dr. Megan Nichols and Dr. David Rothstein. Please begin when you're ready.
Good afternoon, everyone. This is Megan Nichols at the Centers for Disease Control and Prevention, and I'll be presenting today with my colleague David Rothstein from the Food and Drug Administration. So to start, I'd like to describe a little bit about the multi-state outbreak that occurred, and it started back in May. So I'm part of a group that does enteric zoonotic outbreak investigation, and a lot of our work is coordination and working with stakeholders and partners to investigate the outbreaks and to provide some recommendations and potential prevention messages. We collaborate very closely with the Food and Drug Administration, the U.S. Department of Agriculture, and many other public and animal health organizations during these outbreaks. One of the pathogens that's seen most common in our outbreaks is Salmonella. And today we're going to talk about pig ears, and that's a treat that's most commonly provided to dogs and cats. So I thought it would be appropriate to discuss what Salmonella illness looks like in these species. So Salmonella, especially in dogs and cats, can be symptomatic, but not always. If symptoms occur, it's usually asymptomatic, not always symptomatic. And when symptoms occur, we can see enterocolitis, abdominal pain, or septicemia, such as what's referred to as songbird fever in cats. And there's a paper that was done that actually looked at Salmonella isolation, and you can see that in animals that have diarrhea and dogs that are healthy, you see similar rates of Salmonella shedding and isolation. However, if you look at animals such as shelter animals or dogs that are eating raw food diets, there you might see increased shedding of Salmonella in their stool. In previous years, we've investigated quite a few outbreaks in both the United States and Canada that have been linked to either pet foods or pet treats. And I've listed some of them here on the slide. Of note, you can see that there is a report of a pig-eared dog treat outbreak back in 2001. And this includes also dry cat and dog foods over multiple years. And I want to highlight something that has been on the FDA website, and so this is actually dating back to 2013, just to demonstrate that Salmonella has been found in pig ears before, and it's something that a lot of our agencies are aware of and tracking. So specific to this particular outbreak of Salmonella, we started to notice in May of 2019 that we were seeing human infections with Salmonella 14512I-, And there were two particular PFGE patterns that were noted. This was before our full transition to whole genome sequencing at CDC. And one of these patterns was actually unique. We hadn't seen it before in the database prior to November 2018. So there was something a little bit distinct about this strain. And we had, at that time, 25 cases from 10 states. When we looked at the whole genome sequences for the cases, there were about 15 sequences available at that time, and all were within 0 to 8 single nucleotide polymorphisms, indicating that the strain of Salmonella shared a was genetically related. And we had these isolates that went back to December of 2018 all the way through May. And what we started to see emerging when ill people were interviewed by states is that many people reported contact with dogs and contact with pet treats. So given this signal, given the Salmonella strain and what we were starting to see emerge, what we did was actually a supplemental questionnaire. So for the initial 25 cases, our state partners conducted these interviews, and we asked questions about contact with dogs and pet treats, and then we also asked questions about pet food exposure, including raw pet food, just to make sure we weren't potentially missing something with respect to illnesses and exposures. And once we had collected that data, we wanted to compare the data we were receiving from ill people with the data that was obtained through our population survey. So this is a survey that is done coordinated here at CDC in conjunction with the Emerging Infections Program. And what we saw from the data that had previously been collected is that 61% of healthy people reported contact with dogs when interviewed, and 16% of healthy people reported handling dog treats such as pig ears. So we wanted to compare those numbers to what we were seeing among our human illnesses. So in this case, we actually saw 89% of ill people reporting dog contact, and this was this was done actually in August to look at some of the more recent cases. And 73% of cases reported contact with pig ear dog treats or dogs that had been fed pig ear dog treats. So you can see, especially if the general population or our population survey indicates that 16% of people indicate they've had contact with, healthy people indicate they've had contact with pig ear dog treats, and 73% of our ill people indicate they've had contact with these pet treats, that this is certainly a significant type of exposure. So the next step after collecting a lot of the epidemiologic data was that health and regulatory officials in several states, and I've listed some of them there, along with FDA, collected pig ears for product testing. Some of these pig ears came from ill people's homes, retail locations, supplier locations, and distributors. And when testing was done, there was Salmonella identified in over 90 samples with many, many different serotypes. And one thing that I do want to also call attention to, and thank you again to our partners in health who took some of these pictures while they were out at the pet stores, but one of the things that was interesting is we had products, and this is the picture there on the lower right of the pig ear, that said it was treated by irradiation, and yet they were still testing positive for Salmonella. The other interesting thing is that when we looked across the whole genome sequencing data, and again, this is back in August, we had 92 isolates. 87 of those isolates were from ill people and 5 from pig ears. When we looked at that, we saw that 90 isolates had predicted antibiotic resistance or decreased susceptibility to at least one of the following antimicrobials. So we were seeing multi-drug resistance in this outbreak. We were even detecting genes, resistance genes, that hadn't previously been seen before in the United States, and we were finding them in the pig ears and in the people who were sick. So as of August 22nd, 2019, you can see our outbreak epi curve is here with the months across the x-axis and the number of ill people on the y-axis. And you can see that the outbreak had likely started maybe back in 2015, 2016 at a very low level, and then with what we did with extra surveillance and case finding, we really saw that uptick in late 2018 and 2019. So to warn the public about the potential risk to people and to their animals from these contaminated pig ear dog treats, the CDC and FDA issued an advisory not to buy or feed any pig ear dog treats, including those that were already in the home. We also talked about what you can do and steps you can take to prevent illness when feeding your pets. And if you look at the map of reported illnesses, we saw that there were cases ranging from the West Coast all the way to the East Coast, with the majority of cases being in the Midwest. Now, on the questionnaire we administered, we also asked some information about how often people wash their hands after handling pet foods and additional treats. And what we found is of 32 people who had a questionnaire completed with this question, 69% said they never, rarely, or sometimes wash their hands. So this demonstrated to us that perhaps more hand washing was needed after handling pet foods and pet treats to prevent illness. So in continuing to craft our message, our goal here was to prevent additional illnesses and provide advice to consumers. And we wanted it to be specific, clear, and complete. So we have a section on that outbreak notice that includes advice to pet owners and to retailers. And we have an infographic that we thought, we're big fans of this infographic. It's available. I included the link below in case you would like to download that and use it. But it does talk a little bit about the potential contamination of pet food with germs. It covers both raw pet foods, and there's a section on there that talks about hand hygiene. Thank you, and with that, I'll turn it over to my colleague, David.
Good afternoon to everyone, and thank you so much for this opportunity to present our work that we did with FDA, the states, and CDC. So Megan's already pointed this out, but from our investigation partners working with CDC, and I've highlighted certain states or specific states because of some of the sampling work that they did that was so helpful from our side of things, which is the regulatory. Here at FDA, we have our partners that are involved, including our communication staff, our veterinary laboratory investigation and response network, that for some listeners may be familiar, some may be VetLearn partners, but VetLearn is established by FDA, and we work with veterinary colleges and state diagnostic labs. So it really helps us with the animal diagnostics, which is something that we don't do at FDA with our testing. So that's really supportive for our regulatory efforts. We have a division of animal feeds, our post-market compliance feed team, and the team that I am on, which is the complaint, emergency, recall, and reconditioning team. So it's kind of a multiple groups that are involved in the scientific efforts, the regulatory efforts, and basically any plans that we have to follow up after the investigation concludes. The work in this that I'm going to talk about is our Traceback and our product testing. And Dr. Nix has only pointed out about the 90 samples that were collected, but with our product testing, we also had our FDA regulatory samples that were collected. And this is any product that is sealed in its original container. For us, that we got some product that was at distribution centers, but also retail. We also had states that had done non-regulatory testing where they collected product, for example, from bulk bins, which for us, from a regulatory stance, is difficult to completely use for any sort of regulatory action like recalls. And then we had states that had done some regulatory work of collecting individually wrapped or small bagged product. This includes retail stores that were brick and mortar as well as online as well. As far as the traceback, I won't show the entire traceback diagrams for all of this because it's quite extensive. And but the basics of it that you're looking at is that we go, for example, from a point of sale, looking at receipts, invoices, bills of lading, any information that provides to us where that product originated. So in other words, we're going backwards to find out basically where the source of the product is from. And sometimes this is very clear cut. Sometimes it's a little bit more complicated. Firms sometimes do not use the same, for example, lot numbers that may not be coming from, the supplier might have a lot number, but by the time it gets to a point of sale, it has a completely different lot number. Some lot number information is not as clear cut, so that makes things a little bit tricky. But this is just to give you an example of using that traceback from 3 different human cases and going back to where their suppliers are from, to either a distribution center or a main source, getting all the way back to the initial supplier. And in this case, for this particular investigation, based on the human cases that we had information from, we were able to determine there were 4 foreign suppliers, 1 from Colombia, 1 from Argentina, and 2 from Brazil, as well as a U.S. manufacturer that were all the sources of product. And so this does not support a point source, but does get into more of the overall preventative controls of production methods that are involved. As far as our samples, and I'm not going to show all 90, but I just want to get into our regulatory samples just to show you there's a lot involved. The samples included are samples from FDA, but as well as state samples. And by using those positive results, we're able to key in on the manufacturing source, all the isolate information with the whole genome sequence, which we do on every regulatory sample that we get, whether it's from us or from the state. We want to ensure that's done to help support the efforts to looking at the outbreak. So that provided us a lot of information for this particular outbreak investigation. In addition to the human cases and the samples that were collected in support of that, once we have recalls that occur, sometimes it happens before, but usually when we have a recall, we start to get the public starts to put things together with their own pets. And we received approximately 14 complaints. With those complaints, 2 involved those with human illness. We at CVM will not test any human samples. In those cases, we do reach out to let the people know to make sure to contact their doctor or their state public health department. As part of our actions, when we receive these complaints, we do a medical record review. We may be collecting fecals or other samples. If there's happens to be a death, we'll go ahead and do a necropsy with a full histopath. We will test products. VetLearn is not necessarily regulatory, so the labs that they use will test open product. It's not just pig ears, but if we're looking at a cat food or a dog food or even cattle feed, any of that, this gives us a signal of what's going on. But other subset of complaints, 5 we were able to follow up on. The majority involve bulk product exposures, so they're purchased from bulk bins or a bulk order online. We had 1 product that was bagged. As far as our results, we did have cases where either the fecal or the pig ear was positive, and we did have 1 product in which the fecal and the pig ear were positive, but we got different salmonella from these. And so we still have some additional work into this, but hopefully this highlights the importance of that One Health approach, because we're able to look at the human side, the animal side, and then the product. So we're getting all this information to help support the work that we're doing. So the outcome from all of this, and there's still ongoing work with it. So for example, we have what's called a post-response. And that's where we get into more of the long-term things like inspections or working with foreign firms, outreach through our communication. Those are things that are more of our long-term outcomes that we are working on. We are also working to make sure that we communicate with industry of what we're finding, and also getting industry to look at their own practices as well. One of the outcomes that's a little bit more obvious is when we do have these recalls, and we did have 5 firms that did do recalls and provided that information in press release, and these are all online and available, and you can also find them both through the CDC and the FDA web updates. You can get links to those. As far as foreign firms, and this is publicly available, you can look up, you can Google FDA Import Alert 7203. When we have firms that have violative products, we can basically put these firms on import alert. That is, they can't bring in their product, but we do provide provisions for how they can eventually bring product in. But it's a good way for stopping things from coming through. Last thing I'll just mention that Dr. Nichols mentioned is that we did have a mix of product that was both irradiated and non-irradiated. And so in terms of our long-term, there is a lot that we still need to learn about this product and its production. So with that, I will thank you all for your time. Thanks.
Thank you. At this time, we'd like to take questions for any of our presenters. Call 1-800-593-8936 and enter participant passcode 9611836. Press star 1 and give the operator your name and affiliation. Please name the presenter or topic at the beginning of your question. I think we only have time for 1 or 2 questions. Shauna, do we have any?
There are no questions in queue at this time.
Okay, let's give it just a second. Okay, if we're showing no questions, I'd like to just thank all of our today's speakers for their excellent presentations. You can also email questions to presenters. You'll find their email addresses on the ZOHU Call webpage for today's call. Instructions for receiving free continuing education are available at cdc.gov/onehealth/ZOHU/continuing education. The course access code is OneHealth 2019. To receive free CE for today's webcast, complete the evaluation at cdc.gov/TCEonline by November 4th, 2019. A web on-demand recording of today's call will be posted online at cdc.gov/onehealth/ZOHU/2019/october.html by November 5th, 2019. Our next call will take place on Wednesday, November 6th at 2 p.m. Eastern Time. Please send suggestions and questions to zohucall@cdc.gov. For more information and to subscribe to our email newsletter, please visit cdc.gov/onehealth/ZOHU. Thank you for your participation, and this ends today's call.
Thank you for your participation in today's conference. You may disconnect at this time. Speakers stand by.